Hello everybody, I'm Anne Aslett. I'm the CEO of the Elton John AIDS Foundation, and I am absolutely delighted to be sitting down virtually with Lucy Wood to talk about some of our work in South London. Lucy, could you introduce yourself to everybody and explain what the program is that you're working on in collaboration with the foundation?
Hi everybody, I'm Lucy Wood. I'm really delighted to be working here at Lewisham Hospital, where with EJAF's help we've managed to start HIV opt-out testing in our emergency department. I've been results coordinator for the project since November 2018.
Can you talk a little bit about what life is like for you and your team at the moment?
It's been very strange, as I'm sure it has been for everybody. It's a whole new way of working for us in some ways, although we used telephone and email consultations in the past, not quite to the level that we're now using them. We've got a lot of stable patients that we've identified, so we're not seeing them as much for face-to-face appointments, and we're sort of having to delay blood tests and things like that for a little while in those stable patients, and doing appointments via, as I said, telephone or email. And we're having to constantly juggle our clinics just to keep up with all the differing social distancing measures and infection control regimes. And obviously that can be quite challenging when you think you've kind of sorted out a clinic and then you've got a new diagnosis or a patient who's really poorly in the mix, or maybe a loss to follow up who we've suddenly re-engaged. So it is a real juggle for the team, but everyone's doing really well. I think the other thing is just, general anxiety levels have been raised, I would say, and everyone knows someone who's been impacted by this awful pandemic. So it really has been quite a challenging time, but we've pulled through as a team together.
What do you think are the biggest challenges then facing people living with HIV in London, in your area at the moment?
London, in terms of the non-COVID related issues, obviously London has one of the highest numbers of people living with HIV in the UK, with really high rates of late diagnosis, so that's a really big challenge. And unfortunately, stigma is still a big issue. And I would say that's been my experience, that this often prevents people from getting tested, from accepting their diagnosis, and from getting the treatment that they need. It seems to be particularly problematic amongst our West African and Caribbean communities. COVID related wise, I'd say the challenges are that we have a number of patients who don't access care locally, and again that sometimes comes back to those stigma issues, so they're travelling quite long distances to get their HIV care. And that means it's therefore harder for them to engage for any necessary tests, any medication, due to restrictions on travel at the moment. So that's been challenging for a lot of people. Then we have our patients who are shielding, and they're experiencing really high levels of social isolation. Coupled with that, we then have reduced access to mental health services as well.
It's extraordinary that we're still talking about this massive stigma in relation to people living with HIV. Can you tell us a little bit about what your team are doing to improve outcomes for people living with HIV as part of this Social Impact Bond project?
Lewisham Borough has an extremely high prevalence of HIV. It's about 8.6 per 1,000 residents. We introduced routine opt-out HIV testing in our emergency department at Lewisham Hospital. So the aims that we have are to reduce numbers of unknown HIV diagnoses through this work. We want to prevent late diagnosis and unnecessary hospital admissions. So we want to really improve patients' quality of life and save our NHS all the resources it needs. And that's obviously even more pertinent now. A late HIV diagnosis will increase a patient's risk from a lot of infections, which can lead to a lengthy stay in hospital. And that also has increased mortality risks as well. 40% of our new diagnoses in the borough of Lewisham are late diagnoses, and actually this has been reflected in our results here. We found that actually 73% of our new diagnoses have been late presentations.
Wow.
However, due to a lot of the testing in the department, many of those, even though they've been quite poorly, because of the testing, have actually not had to be admitted to hospital. Through our work, we want to engage patients who've been lost to care, so lost to follow-up from any HIV services. Unfortunately, there's a number of patients who've disengaged for a variety of reasons, often a lot of social reasons, a lot to do with stigma, all sorts of reasons. And testing in the emergency department, where many of these patients are actually frequent attenders, means that there's a great opportunity to re-engage those patients through collaborative working between our department, the HIV clinic, and the emergency department in the hospital.
When we're talking about loss to follow-up, you're talking about people who have already had an HIV test, they've
Yes.
gone on treatment, they've taken their treatment for a certain amount of time, and then suddenly you lose them. They don't turn up for appointments, or they don't come to collect their medications.
That's right, yes. So there are a number of those patients who disengage for varieties of reasons. Some haven't even started medications, we've found as well. So really important that we try and re-engage those patients and try and help them with those issues that they're facing. We also aim to obviously tackle the stigma. So just by engaging with the staff through teaching and being present in the department and having conversations and trying to normalise the testing, we want to tackle that stigma both amongst the patients and amongst our staff here as well. And then lastly, through the outcomes, we want to obviously provide evidence for the work that we're doing, that, you know, we really want to provide a business case to the trust so that we can continue HIV testing as standard practice along all routine blood tests.
I'm fascinated when you talk about, you know, reducing the stigma and normalizing the testing, and this notion of opt-out testing, which of course means that instead of specifically asking someone, would you like an HIV test, you're saying this is what we do as a matter of course, unless you have any problem doing this. And it feels like such a different thing. It feels like such a different ask in terms of the stigma associated with it. What's been the challenges of working in this way?
I'd say the team here at Lewisham, they've been amazing, both in the clinic here and also down in the emergency department. Everyone's really embraced the testing, and they've worked really well as a team to get like the best possible outcomes for our patients. In terms of the SIB and the sort of outcome-based model, I suppose it creates an underlying pressure in terms of reaching targets, and that can sometimes cause issues between perhaps the different SIBs. However, I would say that the model kind of creates motivation and an accountability that's really invaluable. I've learned that the model really does help to promote innovative work that improves patient outcomes and actually saves the NHS precious financial resource, and it enables the work to take place that otherwise wouldn't have been able to, and then creates opportunities, like I said before, to create, you know, to present business cases for the work that really needs to be done by trusts and CCGs.
Yeah, and I mean, it's obviously something that we're gonna hope to demonstrate as comprehensively as possible through this project about, you know, what it does save in terms of not only costs, but you talked earlier about people, if they don't know, if they haven't been tested and then they come into the hospital and they come in really sick, it's much more traumatic for the patient as well. So there are real opportunities there to demonstrate that it's made a difference. What gives you a sense of satisfaction from the work that you're doing? In
a nutshell, really, what we've talked about is just the outcomes that I've witnessed, and as a team that we've witnessed, have really been amazing. And it makes me so proud. You know, as a nurse, I'm a nurse because I love people and I value people and I want the best for other people. That's where my drive comes from. So going back to the outcomes here, they are amazing. And we've had 41 new diagnoses, and 39 of those are engaged with HIV services now. Our first new diagnosis in the department was an 85-year-old. And this was a patient who'd been seen in, you know, number of different departments. It was just a fantastic reminder right at the beginning, right at the outset, that we can't make prejudgments about who may not have HIV. There's a lot of people in our community here who've never been tested or have not been thought to be tested because they're not deemed to be at risk. It was really helpful to the project that it was a quite unusual case that really was so outside the box, and it's really, I think, helped people to recognise that everybody needs to know their status.
one of the few sort of positive things about the coronavirus is that whereas there perhaps wasn't a general understanding about the value of being tested, you know, continuously for things, about really knowing your status, knowing whether they're at risk to themselves or other people, is incredibly important with an infectious disease. And the fabulous thing about HIV that I also don't think people understand more generally is that if you are tested and if you get on treatment, you can have a normal life and a normal life expectancy. And more than that, you won't pass HIV on to anyone else.
We've also identified 21 patients who've been lost to follow-up from HIV services, and 16 of those are now re-engaged in care. And one of those was lost to follow-up for 12 years. And when they presented to the emergency department, their immune system was found to be really compromised, but they're on treatment, they're doing really well, they're engaging with their care. And the HIV testing in the emergency department prevented decline in that patient, and again prevented unnecessary and traumatic hospital admissions. We've also, in fact, it's more than this now, but at the point when I, was looking at the results, we had 8 patients that we'd re-engaged through the work in the clinic. Seeing patients who've been so ill and then just seeing them really flourish, it's just been brilliant. And like you've said, treatment for HIV now is fantastic, and you'll live for as long as you would have lived, with good treatment and good adherence. It's also been the gratitude from the patients, people who said, I'm just so grateful because I never would have thought to have tested. Everyone's so chuffed with the outcomes and the work that we're doing. And it's just also being part of that wider work to eliminate the stigma and the new HIV infections in London. It's really all of those things that really bring a lot of satisfaction to my role.
We've talked a bit about, in hospital and what's happening in the emergency department. What about outside in the community? How do you and your team make sure that HIV care is kind of maintained in the community when people are not in the hospital receiving treatment?
Testing has continued throughout the pandemic, and that's proved vital to make sure that the correct diagnoses are being reached for patients in a timely way. We've had some presentations of, sort of defining AIDS-defining illnesses, respiratory illnesses like the PCP pneumonia, which can look quite like a COVID presentation. So having an early testing in the department has been really key. And although the total number of patients that have come through the department has dropped, and therefore we're not having as many tests, actually the testing rate has really, it's been amazing. We've obviously continued to see patients who've needed to be seen in line with sort of our trust policies around infection control here, just to ensure continuity of care. And we obviously work with our community CNS team as well to make sure people are receiving what they need. We had a number of patients who we signed up for home care delivery for their medications, which was really crucial. And we continue to refer patients for peer support where needed. There's been a lot of telephone calls and making sure we're available to speak to patients and redirect them to the right services.
Are there any other stories you could leave us with that have really struck you in the course of the work?
One that really stands out was a new diagnosis from one of the quite a high risk group, or classically we describe as someone from a high risk group who'd only ever had one sexual health screen, and multiple other doctors had seen the patient previously and the testing hadn't happened. The patient ended up being diagnosed very late, but testing again in the department has prevented that patient getting sick and needing admission. Through this patient's diagnosis, we then also diagnosed their partner, who was also a very late diagnosis.
Oh, wow.
And also had never had a sexual health screen before. They are doing brilliantly. They're on treatment, engaging really well, but it just goes to show that I think there are sections, like I said earlier, sections of our community, both in groups that you would have thought had been tested and in groups that you just wouldn't have thought needed testing, that are really benefiting from this.
And do you find that people who, as you say, the example where, someone's had very little sexual health screening and they're tested, and they might have been infected for some time, Do you find people are shocked, or has there been somewhere in the back of their mind the thought that they might have put themselves at risk? Obviously, every patient is different, but what's your experience of some of the reactions that you get from people?
I think there's been a mixture of the two that you've talked about. There are the patients who perhaps know that they might have been at risk, but it might have been very traumatic for them, and therefore that's not something that they've wanted to sort of dig up and face. And then there's been others where it genuinely has been a real shock.
The thing we've just got to get across to everyone is that, as you said earlier, with the testing, if you do know your status, then you can get on the treatments, and the treatments are really, really good now. It's really important for people to understand just how simple good HIV care can be.
Absolutely, yeah, and just saying there are options as well, and it's just about creating a really good relationship with our patients where they know, we can sort this out. If there's anything that you're not happy with, we can work together and make a plan. The outlook is so bright, and it does make me really sad. We have had the odd case where it's been too late for people to start, for the treatment to be effective, and it makes me so sad when I know there's something, there's a treatment that people can take that will mean they can live for as long as they were ever meant to live.
The foundation is certainly lucky to have you as a partner, and I think the patients that you're looking after and re-engaging in care and supporting you and your team are lucky to have you too. Thank you so much, Lucy, for sharing your experience.
Thanks, Anne. Thank you to you all too at the Elton John AIDS Foundation. And I just want to say a really big thank you to Lewisham and Greenwich Trust as well, and all the staff here that have supported us, and to the wider teams who've been, a huge part of all of this. So thank you to all of them as well.
Yes, indeed. And together we will get to an AIDS-free future in the UK.